Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Sangat Ji, my name is Gurpreet Kaur. I'm a clinical psychologist based here in the UK in London, and I'm hoping to put a few short videos together on varying aspects of mental health. So this is the first video, and in this brief video I'm just going to talk a little bit about what's motivating me really to put together these videos. I'll also go on to talk a little bit about how we discuss mental health within our community, and I thought it'd be useful to share some information about services and how to access services. And please stick with me, because at the end there'll be a short questionnaire which I'm really hoping that Sangat will spend a few minutes completing. So the number one reason for making these videos has to be, without a doubt, because of Sangat. There's a real drive within our community at the moment to understand mental health difficulties and kind of move away from older, more stereotypical views of what mental health is and is not. So not only is there an understanding, but there's also a drive to really learn more about the experience of mental illness, but also to support people experiencing distress. So the second reason I'm hoping to create a short series of videos about mental health difficulties is because I truly believe that as a Sikh community we have a huge body of knowledge amongst us about how to actually work with mental health distress and how to support people experiencing mental health difficulties. Now the reason I'm saying that is because certainly over my career I've seen so much interest amongst the youth in thinking about accessing careers that are more to do with mental health difficulties. Alongside that, there's also been a boost in jobs in various mental health services. So the route to working towards supporting people with mental health distress has widened. It's not as narrow as it used to be. And I think it'd be really fantastic to be able to pull that knowledge together in terms of gathering or generating ideas to think about supporting our community in a much more enhanced way than it currently is. So please do fill out the questionnaire at the end, and I'll be happy to present that information back to the Sangat. So the third main reason for creating these videos is really about accessibility. Now I'm thinking about people within their own homes who may be experiencing themselves or witnessing somebody else experience mental health distress, and not necessarily having the language to be able to label what's happening around them. And I'm not talking about language barriers here, I'm not talking about Punjabi versus English. It's very much, you know, being able to have that understanding about certain distressing behaviours or unhelpful behaviours that people are displaying, and be able to actually label that in order to understand what's actually happening. Now, if people are at home and they haven't got much access to the community, or they're very limited in what they can do outside of their daily routines, I'm hoping these videos will be a good and easy way for people to access information about mental health distress. I also very much understand how isolating and lonely that experience can be, because I myself grew up with a very close relative who was displaying signs of mental health difficulties really from an early age, and it took years, it took a very long time for that person to be diagnosed with what eventually was diagnosed with psychosis. Now if we can actually help people together as a band by enabling them to access hopefully some of these videos and information online, somebody's experience may be less difficult, because they might have an understanding or might develop an understanding about what's happening around them, and they may actually be able to seek help sooner. So the fourth reason for putting together these videos is really to do with a Sakhi I heard about Bhai Bella and Guru Gobind Singh Ji. So Bhai Bella was a Gursikh who wanted to go and visit Guru Gobind Singh Ji and spend time with them at Anandpur Sahib. Guru Gobind Singh Ji was happy with this, but asked that Bhai Bella do some seva in return. When Guru Gobind Singh Ji asked Bhai Bella if they could do langar seva, Bhai Bella said, "I'm sorry, I can't cook, I don't know how to do that." So Guru Gobind Singh Ji asked Bhai Bella, "Can you fight?" And Bhai Bella said, "I don't know how to use Shastra." So Guru Gobind Singh Ji then said, "Do you know how to read Bani? Can you recite Bani?" And Bhai Bella said, "I'm sorry, I can't read." So Guru Gobind Singh Ji found a job for Bhai Bella. It was to do with looking after the horses, feeding them, looking after them. And in return, Guru Gobind Singh Ji said they themselves would teach Bhai Bella a line of Japji Sahib every single day. So every day Bhai Bella went along to meet Guru Gobind Singh Ji and learn a new line of Japji Sahib. And then throughout the day, Bhai Bella would recite this line in order to memorize it. Now one day, Bhai Bella went along to Guru Gobind Singh Ji to learn another line of Japji Sahib, and Guru Gobind Singh Ji was busy, and they couldn't teach Bhai Bella. Now, Bhai Bella must have been asking, I think, to teach the new line, and Guru Gobind Singh Ji responded, Bhai Bella, na vakt vichare na vela, meaning, you don't understand the time or the circumstances that's happening around you. But Bhai Bella took this to mean that this was the next line of Japji Sahib, and happily went off and then carried on reciting that throughout the day. So Gursikh, who heard this happening, I think there's different versions of the Sakhi. Some Gursikh must have become angry, thinking Bhai Bella was basically taking the mickey out of Japji Sahib, and there were other Gursikh who were laughing at Bhai Bella, saying, what's he doing? And so the next day, these Gursikh took Bhai Bella along to Guru Gobind Singh Ji to say, look what he's doing, look what he's saying, and regarding his Japji Sahib. Now, Guru Gobind Singh Ji, when they heard Bhai Bella say the line that Guru Gobind Singh Ji said the previous day, Guru Gobind Singh Ji actually got up and hugged Bhai Bella. Now, I think the moral of this Sakhi that's usually associated with it is to do with Nimrita. So being able to, reduce one ego in order to listen to what Guru says and take on board what Guru says without too much questioning, without, the why, all the questions that might come with it. I think the bit that really stands out to me about this Sakhi is the whole idea of inclusion, and the fact that Guru Gobind Singh Ji didn't say, actually, you're no good, you can't do this, off you go. Instead, Guru Gobind Singh Ji said, okay, if you can't do this, let me find something else for you. Okay, if you can't do this, I'll find something else. And they kept going until they found something that Bhai Bella could feel a part of. And he did an important part of Seva. Guru Gobind Singh Ji actually helped Bhai Bella connect Dubani as well. And this is pretty amazing, because I'm sure Guru Gobind Singh Ji was extremely busy, but they found time to connect with someone in the Sangat who was obviously, for some reason, whether Bhai Bella had some kind of mental health difficulty or learning disability, there was some kind of difference there. And Guru Gobind Singh Ji did not exclude them, they included them. They made an extra effort to really include them in the Sangat and Seva. To me, Guru Gobind Singh Ji showed compassion and patience and a lot of pyar. And I think as a Panth, there is so much we can learn if we just do a little bit of vichar on this Sakhi alone. I'd like to ask Sangat just to take a few seconds to read this definition of mental health by the World Health Organization. Now, as you can see, it actually refers to a state of mental health well-being in which a person actually realises their own potential and are able to cope with stresses in everyday life. Now, we may align this with mental health positivity, mental health wellness. Mental health generally refers to a person's psychological, emotional and social well-being. Now, within our Sikh community, I have noticed that sometimes the terms mental or mental health will be used to refer to people who are experiencing mental health distress or mental health difficulties. And it also seems to have attached to it an almost negative connotation, which we could infer, might mean stay away from that group of people. I think we need to be very careful about the language that we're using, because it seems to have filtered down through generations, and some of the myths or some of the stereotypes around mental health are also very prevalent. I would suggest that after watching this video, that you talk to somebody who's within your immediate network, so somebody within maybe your family or a friend or a colleague, generally and casually about what they understand about mental health. And it'll be interesting to see, you know, what kind of conversations come about, and whether you can dig a little deeper to see whether, you know, they hold any negative beliefs about mental health or people with mental health difficulties. Now, as a community, if we're not collectively working together and supporting people with mental health difficulties, what we're doing, or what we may be doing, is actually the reverse of that. So we may actually be encouraging people who are in difficult situations to maintain that situation themselves and to hold the stress of that situation themselves. Because if they haven't got sangat that they can tap into, that they can't access, they won't have an outlet necessarily to be able to talk about or discuss some of the experiences that they're having. What we also know is that when people experience a high level of stress, and the stress stays in the family, what we're doing is actually making them more vulnerable to mental health difficulties. And if that goes on for a generation or generations, over time, genetically, people born into that family are going to be more predisposed to experiencing mental health difficulties themselves. So what we can see is a real negative long-term effect of not talking about and not supporting people with mental health difficulties. Instead, what we need to do, and what we know we need to do, is create avenues for people to be able to touch base, to feel a sense of connectedness and to feel a sense of support by being able to talk to people about what they're experiencing without being judged. In our busy day-to-day lives, I don't know about you, Sangat, but often it feels like, you know, it's hard enough just to keep on top of everything you need to do. Sometimes it's almost as though, you know, people in families are like passing ships. Everyone's so busy with their schedules that it might be difficult to actually touch base with each other. Connectedness, so feeling a sense of belonging to people, to groups, to activities, is so important for a person to feel as though they're maintaining their mental well-being. So please do make sure that you're spending time connecting with the people who are close to you and checking in with, you know, not just how was your day, it's been okay, yes, no, but, you know, really checking in with what was good about their day, how did they feel about this thing that happened, what thoughts did they have about that event, what did they do that made them feel positive that day. So just, you know, trying to delve a little bit deeper than the normal questions we might find ourselves asking. It's especially important with children, because what we want to do is actually teach our children about how to maintain their mental health well-being. And a very important way to do that is to be able to label what they're experiencing themselves, to be able to understand their internal emotional state. So if a child gets suddenly angry at something, you know, it's important for them to understand that actually it wasn't just that small event possibly that made them angry. It might be related to them feeling low in their confidence, or they may feel as though they're being judged or harshly criticised. And then it's important to obviously have that dialogue with family members. So, for example, a child who may be feeling anxiety, they may have stomach cramps, they may have headaches, they might be sweating, they might think physically something's wrong with them. Whereas actually it'd be really important for that child to learn that they've got an emotion in them that's presenting itself physiologically, because that's a very common thing with anxiety. And helping them make that connection might be really useful, because then they'll be able to attribute it to a thought that evoked the emotion. It's really important to teach our children how our mind works and how it's linked to our body and how it's linked to our emotions. When we think about our Sikh community, a lot of research suggests that we don't access mental health services really as much as other communities. So when I'm saying we, actually I'm thinking about research referring to South Asians, because there isn't that much research on the Sikh community. What we do know is that South Asian women tend to have higher self-harm rates, higher rates of eating disorders, and are more likely to present to their GP with physical health problems. So mainly, you know, presenting with psychosomatic difficulties, where psychological difficulties manifest in the physical form. But there isn't a huge amount of knowledge. So if there are any young viewers who are currently studying and they've got a title to think of their dissertation or their thesis, doing some research within the Sikh community would be a huge seva, because there really is a paucity at the moment. There's just not enough literature to help us understand what's going on within our community. If sangat are wondering about how diagnoses are actually made, they should be made by a psychiatrist, and a psychiatrist would generally refer to two main sources. So one being the ICD-10, which is the International Classification of Diseases, and the other being the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. Now, those manuals, both of them, are huge, and there are a lot of diagnoses within them, and each diagnosis has a certain set of criteria that a person would have to display in order to get that diagnosis. You know, there's a lot of thought that should really be put into a person's presentation and diagnosis prior to them actually being given that diagnosis, and it should be discussed with you as well. So if you just suddenly receive a letter and that says, you know, you've suddenly got this diagnosis, I would call up that psychiatrist and discuss that with them. So just thinking about services now, just in case, you know, there's anybody out there who's got a question about what to do if you want to seek help for yourself, if you're experiencing some kind of distress, or if you want to seek help for somebody close to you. The first thing to do, or I would encourage you to do, is really just, you know, start reading, start learning, Google whatever it is that you're experiencing. We're going to call that really the first level intervention, because what we always encourage people to do is that kind of level of self-help. So trying to find out information to better inform yourself. The reason I'm really encouraging people to do that is because, you know, I work in the NHS and I've seen services really be cut quite dramatically, and it's just, it's important for people to be really informed about what they're experiencing. I think it's important to move away from this idea that a professional will be able to, you know, really hold you and really keep you in mind and make sure you're okay. That's obviously still there. We have some great people working within the NHS, but it's more important to actually now start informing ourselves and making sure that we are able to make decisions about what's useful to us, and what services we want to access, or what services we can access. So if you feel able, please do start that first level of self-help and try to learn a little bit more about what it is that you might be experiencing. Now, there will be a series of videos hopefully being released after this one, so they may be useful in helping you understand some of the experiences that you may be thinking about. Or obviously there's a whole body of knowledge, there's a whole internet out there with so much information you'll be able to access. If we think about, you know, the next level up from that, so you've got some information, you've got a general idea about what you might be experiencing, or you have, you know, some questions about this thing that might be going on. What I would advise you to do is go to your GP. That might not be easy for everybody, I do understand that, but if you can, try to access a GP who will be, you know, receptive to what you've got to say. GPs are the people who generally hold all the information about us. They just collect that kind of central pot of knowledge, if you like, on each of us, because all the letters from other services go to them. Now, a GP will be able to point you in the right direction towards other mental health services. The first one being a primary care level intervention or service. Now, if you're thinking more about psychological therapy, you could find a primary care service yourself. You can actually just Google primary care psychological therapy and just write the area you're in and see what comes up. And most primary care services, you could contact yourself and also make a referral for yourself as well. So if you really don't want to go through your GP, that's another route that you can go, just self-refer. If we think about secondary care services, you know, I'm thinking, this is where I work. So I work within a CMHT, which is a secondary care level, if you like, or service. And it's to do with people who really, their difficulties might be slightly more enduring, or they might be more complex, or the level of risk associated with them has just elevated that little bit more. So people might be self-harming, they might be having suicidal thoughts, for example. If a person continues to display worrying behaviours or their level of risk increases, we may consider, talking to that person about whether they actually need some respite by going on an acute ward. Now, that can be done voluntarily, so the person can actually decide themselves to go onto the ward. But if the person actually becomes very high risk and they're in such an elevated, mental state that they're not able to make an informed decision, or they don't have capacity to make a decision, then a team might form around them to make that decision for them and actually agree that the best place for them would be on a mental health ward. Throughout this, you should have care plans, you should be informed about what's going on, your family members should be informed as well. And if you're not, then please call up that ward or call up that service, and you should be entitled, as long as the patient themselves agree to it, to be informed about what's going on. Now, there are so many services within the community that can be accessed that there'll be too many to talk about in this video. So what I'm going to do is I'm just going to share this information with you now. Now, if you are thinking about pursuing psychological therapy, either for yourself or for somebody close to you, I would request that you check out a person's professional registration. So years ago, anybody, for example, who did a psychology degree would be able to call themselves a psychologist. Thankfully, this has stopped because that's a really unhelpful way to access help. There are a number of accrediting bodies that exist now, and we all need to be registered with them. So, for example, the Health and Care Professions Council, art therapists, social workers, clinical psychologists, we all have to be registered with them. You can easily go online and you can check a person's professional registration. And obviously this will differ depending on the type of clinician you're accessing. The reason I'm saying this is because on various, I would say, Sikh media platforms over the years, I have seen people presenting themselves to be working within certain areas where they're not actually accredited or qualified to be saying that. So where we may have a helpful person, especially at the Gurdwara or within our sangat, who might say so and so has worked, in this area or that area, I think it's important just to take that with a pinch of salt, check out their professional registration if you're really thinking about pursuing therapy with them, and just make sure you're comfortable with that, because therapy is extremely personal and you don't want to be sharing highly personal and sensitive information with somebody who's not qualified or is not as experienced as they need to be helping you manage your difficulties. So only two more points to raise before I end the video today. I really do humble benti to all of you watching this video to complete the questionnaire that's at the end of it. It's a brief questionnaire and it will just be such a useful way to gather information from sangat who do have a lot of knowledge about how to really work together and work more collaboratively with supporting people who are experiencing mental health distress, and also really, carrying on this discussion that we're having and educating people about the experiences of mental health difficulties. We want to chip away at those stereotypes. We want to work on, any negative ideas that exist out there, and that can only be done if we do it collaboratively. So please complete the questionnaire, and I will be presenting back the information to sangat. And the final point is really, just a reminder that I will be hopefully creating a few more videos about other areas of mental health difficulties. Now, these will be more specific, so I hopefully will be covering things like psychosis, eating disorders, dementia, trauma, depression, and anxiety. The next one will be on bipolar disorder. Now, a member of Sangat has actually kindly and very bravely agreed to share their experience of bipolar disorder on the video. So it won't just be me you'll be seeing somebody else as well. And, on that note, I do request that if there's anybody else out there who would also like to share their experiences of being diagnosed with a certain diagnosis, please do get in touch. Please do get in touch, and we can think about how to make that happen. So my email address is below, and I look forward to hearing from you. If I've said anything that has upset anybody, or if I've made any mistakes, I can only beg for your forgiveness. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.